With the post-holiday COVID surge underway, hospitals all across Green Country are bracing for a flood of new patients. And right now, many hospitals in our area have few, if any, beds open for new patients. So 2 Works for You is devoting much of our 5 and 6 o'clock newscast this evening to the impact that has on our ability to care for the sick. Here's a preview from 2 Works for You anchor Karen Larson.
Gatherings large and small over the holidays, travel at its highest level since the pandemic began. People not wearing masks or social distancing, and a new, more contagious strain of COVID starting to spread across the nation. It's become the perfect recipe for spreading COVID faster than ever before. And with more and more people getting sick, our hospitals are at a crisis point.
The entire state of Oklahoma has no beds, no ICU beds.
We want people to be, aware of the impacts of their decisions in making that possible or preventing that from occurring.
Health experts say this week we're entering the post-holiday surge in cases of COVID being diagnosed. In the days and weeks ahead, those too sick to beat the coronavirus on their own will flood into area hospitals. At the same time, we're on the brink of what could be weeks of hospitals unable to handle the wave after wave of patients because there simply aren't enough beds and staff to care for everyone.
And there are a limited number of doctors and nurses that have those skill sets to actually take care of those patients.
Worst case scenario, putting some in the horrifying position of having to choose which patients to treat aggressively because they have a better chance of surviving, and which to only give comfort care because it's likely COVID will kill them anyway.
We're not there yet, but that's a possibility.
Karen Larson, 2 Works for You.
Well, join 2 Works for You anchor Karen Larson tonight at 5 and 6 p.m. and hear from doctors, patients, and healthcare experts bracing for COVID's crisis of care.